So welcome back, my dears, for another part, which we'll talk about right now. It's about also the resume working on the PSW or Personal Support Worker course. And here, I just want to say some points regarding the delivering of home care. Home care delivering. Home care delivering. This is very important point. Home care is governed and delivered differs across the provinces and territories here in Canada. It differs from a place to a place, but it's all including based on the provinces and so on and the health system in each province, but it's all regarding assessing clients' needs, determining clients' eligibility for the government-sponsored professionals and support services, and coordinating and monitoring home care services provided by the private or non-profit agencies, providing information and referral to other long-term care services like the volunteers and so on, and people on wheelchairs, some of which charges uses fees to the client, so on. We have the provinces' healthcare plans. We have provinces' healthcare plans, including Alberta. So in Alberta, it's called Alberta Healthcare Insurance Plan. Like we have here in Ontario, OHIP, OHIP, Ontario Health Insurance Plan. Based on each province has its name. So British Columbia Medical Service Plan. Manitoba is called Manitoba Health. New Brunswick Medicare. Newfoundland and Labrador Medical Care. Northwest Territories NWT Healthcare Insurance Plan. Nova Scotia Medical Service Insurance. Nunavut Healthcare Plan. Ontario OHIP, which is OHIP, Ontario Health Insurance Plan. Prince Edward Islands Medicare. Quebec, you can find Medicare here in 212, it's called Medicare. Prince Edward Island and New Brunswick. Quebec is called Assurance Maladie, means Medicare as well. Saskatchewan is called Saskatchewan Medical Care Insurance Plan, and Yukon is called Yukon Healthcare Insurance Plan. These are the bottom names of the plans from each province to the other. Now we will move to something new, it's called workplace setting. We will move now to the workplace setting. Workplace setting. Where the personal support worker will work. This is the meaning of the workplace setting. We started with the home care. Home care, the home health care. Home care means that the personal support worker afford the service of the health care into the people at their homes. So here, home health care service is a wide range of healthcare services that can be given in your home for an illness or injury. Care may be provided by licensed healthcare professional who provides medical care needs, or by professional caregivers who provide daily care to help to ensure the activities of daily living are met. In-home Medicare is often and more accurately referred to as home healthcare. So it means that the PSW or the nurse or the registered practitioner nurse or the RPN, registered practitioner nurse, registered nurse or registered practitioner nurse, or the person support worker, he visit the client or the patient in his home and he do the service in the home of the patient. We have also some points we have to need to refer to about the health services regarding the types of health services. Acute care, health care that is provided for a relatively short time, usually days to weeks, and is intended to diagnose and treat an immediate health issue. It's provided in hospitals. So acute care is done always in hospitals. Acute care is done always in hospitals. So this is the difference between the home care and the acute care. Acute care is done in hospitals. We have also subacute care, known also as convalescent care or complex continuing care. That type of care is health care or rehabilitation for people recovering from surgery or injury or being stabilized after a serious illness or health challenges. So they need a long care or a complex care. Client subacute care is in stable condition. Yeah, his condition is stable, not dangerous or not life-threatening, but still needs care requiring complex equipments and procedures. But here, he needs more and more care. His complication, he's having a complex situation. Many hospitals provide subacute care after a hip replacement, for example. A client may not be ready to go home because they need frequent physiotherapy. They will need physiotherapy. As example, I have a fracture or I have something in the hip. I made a surgery, backbone surgery, or whatever. Then I need, in this case, physiotherapy and dressing changes as well. So it needs some kind of rehabilitation or some kind of things which is very impossible because I need sits and I need equipment, which I cannot do it at home, at the home of the patient. So the patient must stay at hospital and have this period of time and have this training, as example, physiotherapy or whatever, till he become okay. Some hospitals have wards that are dedicated to providing subacute care. Eventually, the client is discharged home or to another level of care. That's if once he's okay, he can go to another level of care. So this is acute illness. This is the acute. So we talk about the acute care. We talk about the acute illness. Acute illness appears suddenly and lasts a short time. So acute illness is for a little time. Usually it's less than 3 months. Symptoms can be severe. Examples of acute illness are pneumonia and influenza. Okay, so this is less than 3 months. Acute illness appears suddenly and lasts a short time. Acute illness appears suddenly and lasts short time, usually less than 3 months. Symptoms can be severe. Examples of acute illness are pneumonia, pneumonia and influenza. Pneumonia and influenza. And this is what we said, the subacute care. So we talk about here now acute care, subacute care, and acute illness. We have also one of the types of the services that a PSW can help in is rehabilitation services, rehabilitations, or restorative care. Restorative care. Therapies and educational programs designed to restore or improve the client's independence and functions abilities. These services are for people who are or have been ill, injured, or disabled. They have disability or whatever. This was another type. Here is another type of the healthcare setting or places where a healthcare provider, like the personal support worker, can work. Palliative care. Palliative care services for clients and their families living with an illness that cannot be cured. Actually, this is things which is chronic and no cure for it, with a goal of improving the client's quality of life by managing pain and other distressing symptoms. Palliative care is an approach to care that emphasizes client goals, relief of pain, and suffering and quality of life. So palliative care is for kind of diseases or sickness which no treatment for it. End of life care. This is for the people who are encountering the last days in their life. And here it is not just physical care, it's physical, emotional, social, and spiritual care. So I just want you to know, my dears, that the end of life care includes physical care, emotional, social, and spiritual care. Four types of care. And supporting also given to people who have stopped treatment to cure or control their disease, as well as support to their families. End of life care may include palliative care, supportive care, and hospice care below, which often work together to help the client and the family during the client journey near their end of life. When the patient is almost to the end of life, he is dying. The patient here is dying. So it's end of life care. We call it end of life care. And end of life care is provided through an interdisciplinary approach. This is the end of life care. What about the hospice? An element of palliative care that provides home, live-in, or inpatient care to a client who has a terminal diagnosis and is no longer seeking life-prolonging care. So, hospice is an element of palliative care that provides home, live-in, or inpatient care to a client who has a terminal diagnosis and is no longer seeking life-prolonging care. The philosophy of the hospice is to provide support for the client's emotional, social, and spiritual needs, as well as medical needs as part of treating the whole person. One of the settings for, or one of the fields of the work of the personal support worker is the community-based setting, or places within the community that provide health care and support services. Examples for us, as example, include the client's home, group home, and retirement residences. Retirement residence or retirement home, in which client live as independency as possible. The most common community setting is the client's home. One of them is the client's home, which means that home care, home care. So that are the types of the places or the workplace setting for PSW. So I can put a question right now, and I go here and say here as example, and I will just put insert here new slide, discuss the types health care that PSW can work in. So that is what we say workplace setting. In that question, you will tell me the same types which I said right now, and you will discuss in brief each one of them. Each one of them. So here you will discuss for me each one of these healthcare services. Like we said before, let us go back and see it back from the start. We have home health care. We have acute care, usually is done in hospitals, like I said before. Then we have here acute illness. We have acute care that's done in hospitals. We have acute illness, like it will take no longer than 3 months, and it has its severe symptoms, like the influenza and pneumonia. We have also here subacute care, which is like a very complex type of care, like this, which happen after the surgeries, and there is no equipments at home, so it must be done in hospitals. Like as example, the physiotherapy after doing a surgery, a hip surgery, or whatever. So this we call it subacute care. Subacute care. Okay. Also, one of them is the rehabilitation services, restorative care, and this is also another type. We talk also about the palliative care services for the clients and their families living with illness that cannot be cured. No treatment. So this we call it palliative care. It's only done for the quality of life, a better quality of life for the patient. End of life care, that is not only a physical care, it's a physical, emotional, social, and spiritual. Hospice or hospice care, an element of palliative care that provide home, live-in, or inpatient care as well. Uh, it's it's about coming to an end. It's about that the client is coming to an end in this case, because the patient is going to an end, and you just afford the dignity and pride for the patient, help him to keep his dignity and help him to keep his pride. Community-based settings, which is home care, which we talked about before. And here now I came to the question of this lecture. Discuss the types of healthcare that a PSW can work, which I said twice till the moment. So please have a paper and pen. Write down inside your notes the answer of this question based on what we handle just now. Based on what we handle just now. Then we will move into the next topic or the next part. Wait here a few minutes for you to get your answers. We'll wait a few minutes to get your answers. Thank you. But can we say that there is advantages for the home care? Yes, of course. There are advantages, mutual advantages for the patient and for the healthcare provider. So the benefit of the home care for comfortability, because I'm comfortable, I'm at home. I'm a patient, I'm sitting at home. So this is comfortable for me. Personalized care means someone is doing this specially for you. He comes to do this, which give a good morale and makes the patient in a good mood. Peace of mind. I don't need to go to the hospitals. I don't need to just I'm sitting at home. Everything comes to me. Quality of life. Yes, it improve the quality of life since I get the services privately and individually. That means, and it's personally as well. That means it's increasing or enhancing the quality of life. Affordable care also, the care here from a professionals who are very affordable. Also, we can say here that the home care enhance safety, boosts independence, enhance self-confidence as well, makes the patient has a feeling of self-confidence, improve the health of the patient, and improve the relationship with loved ones and friends as well. Why? Because there will be no stress in the family in this case, since the healthcare provider, whatever is nurse or a practitioner nurse or healthcare giver, like a personal support worker, he will carry on the things which the family cannot do. So in that case, the family will not be very stressed because of their love, and deeply they will be loving more and more. So this is the home care and disadvantages for the home care. We'll go now to a new question and we'll say, what are the advantages of home care? Home care means that the PSW, home, sorry about that, home care. The home care means, let me tell you again, the home care means that the PSW will go to afford the service, to afford the healthcare service into the client in his home. He will afford it to the client in his home. So this is called home care. And here I will just put, here it is, what are the advantages of the home care? Shall stay here a few minutes for you guys to get the answer before we move into the second part, before we move into our second part. Thank you.